So if you don't wish to have your face showing for this first little bit, that's fine. You can shut down your video. So let me just talk you through kind of what's going on here. Our plan today is to spend just a few minutes as a whole group and just talk about some things that you might want to consider as you're trying to decide whether or not to pursue residency, and some factors to consider when you're choosing where to go. And then we'll do introduction to specific residency programs. You'll be in breakout rooms with the program leaders for each of the programs, and they will give you a rundown of what that program is all about, all the elements of that program, and also be able to answer a lot of your questions. So that's our plan. So starting with the question of why residency, also when to do residency, what a residency is required to include. So there are some things that you'll find are common across all residency programs. And then there are elements that vary from program to program. And so you'll want to figure out what is it that's important to me and my personal goals that would help you decide where you want to go. We'll also look at some characteristics of successful residents, and we've got a few residents joining us tonight, so you can pick their brains as well of what they feel like has been helpful for them coming into this program and moving through it. And then also look at why you might want to be in Utah. So in general, the big benefit of pursuing a residency program is to learn how to think, to really step up your clinical reasoning. And you do that mostly through one-on-one mentoring, where you're asked to justify your decision-making really frequently. And so verbalizing that and thinking through why you are choosing to do a particular exam test, or why you've chosen a particular intervention, thinking about dosage and all the things and what's the next step and what should discharge look like for this person. Those are all things that help you to think better. And so that's what you should expect upon graduation from a residency, is that you think like an expert. You might not have all the pieces of knowledge down pat. There's always more to learn in our profession, but you will have that skill. And the other piece of that, besides mentoring, is some deliberate, structured, continuing education in your specialty practice area. Okay, so in addition to thinking like an expert, you'll have the skill set that's required to advance our profession. So many of you will be new graduates, new in our profession, and you have a lot to offer as new grads, and you'll have even more to offer our profession once you've had a chance to really dig into a specialty area. You probably already know that upon graduation from a residency program, you're qualified to sit for one of the specialist certification exams. And you can do that earlier than if you had pursued the other option, which is accumulating a certain number of hours in clinical practice to sit for that exam. You also qualify for admission to a fellowship program. So if you want to further pursue like additional very specialized training in a particular area, fellowship might be of interest to you. And then also residency grads tend to be very competitive for employment. So definitely going to be looked upon more highly than someone with the same amount of time in the profession, but without having had that very focused specialty training experience. All right. There are advantages both for pursuing residency right out of school and for waiting and getting a little bit of clinical experience under your belt. So I don't think there are any real surprises here, but new grads probably haven't had much of an income yet. And so it feels like less of a sacrifice to have a reduced salary for a year. And you also have very quick early development that can really flavor the rest of your career. The disadvantage as a new grad doing a residency is that you don't yet have a lot of clinical experience to build on and to reference as you're encountering new patients and new scenarios. And then the opposite is true. If you've already been in the clinic for a while, you've spent some time in your specialty area or another area, taking that reduction in salary might feel a little bit uncomfortable, but you have a lot of valuable experience to lean on as you pursue additional training. So there's no right answer for this. This is, what works best for you and your needs in your life. So as you're thinking about which specific residency program is best for you, here are the things that are common among all residency programs. They all offer a minimum of 1,800 total hours. That includes clinic time and educational time and all the other stuff that you do. And that is delivered over as short as a 10-month period or up to 60-month period. All of them include at least 150 hours of one-on-one mentored time, and then an additional 300 hours of learning activities that are related to the specialty area that you're in. Adequate patient care opportunities that fit the DRP, and so you're going to want to see if the places that you're investigating offer you the whole spectrum of what your specialty area includes. And then graduates, again, qualify to sit for that specialist certification exam. So graduates from any program. So as you're looking at the other elements, the things that can vary, think about which unique features you value most. And so that may include the location of the program. It may include the mentors that you be working with, both the quality and the number and the qualifications and experiences of that mentoring. You could also look at what does a typical mentor session look like? And does that kind of fit how you want to operate? Some programs provide on-site mentoring, some provide only distance mentoring, and some do a combination of both. Cost, of course, is important. So you're going to be looking at, is there a salary and is there a fee associated with the program? Are you paying for the curriculum in addition to a residency fee? So just so you have your eyes wide open in terms of what to expect in terms of cost and also benefits. Duration of program, of course, matters. And then your schedule matters because there's going to be varying demand on your time for the programs that you may have interest in. So looking at, is that going to fit the availability that you have and whatever work-life balance is important to you. Didactics could be delivered in person or online or some combination of the two. And then you also might consider whether or not this is something that you would be happy doing on your own as a sole resident of a program, or if you would prefer to have some company with you in that process, or if you're in an institution where you may be the sole resident in a program, but there are other residents in other specialty areas that can kind of help be your support as you're moving through the process. And then finally, there's a variety of other experiences that may be included in a residency program that you value. So if you are looking for an opportunity to teach, for example, or an opportunity to do some sort of clinical research, CI credentialing course, those kinds of things. So what are kind of the extras that a program offers to you? And We can't say that Utah is the one for you, but we can tell you which of these elements, what these elements look like in the Utah programs, and you can decide for yourself if that fits what you're looking for. Our residents are universally strong clinicians when they come to us. So this is not a remediation opportunity. So we're looking for graduates and kind of young professionals who are already good thinkers and are really motivated to learn more and become better, become the best, highest level of evidence-guided clinician that they can be. These are people who are really committed to the process of seeking feedback and receiving feedback from mentors, interested in really being the director of their residency education. So having input of what they want out of the program and making sure they get that. And you can see a few other things here. These are also listed on our main landing page for our residency programs, so you can refer to these again later. But I think the bottom line is, we are looking for residents who we would want to hire as a colleague and employee. So no, I don't think any surprises there. Okay, this is outdated and I failed to update this, but we now have 5 accredited programs at the University of Utah. So neuro, ortho, sports, cardiopulm, and acute care are all fully accredited by ABPTRFE. And then our pediatric residency program has started and is in the mid processes of seeking seeking accreditation, which we expect to get next year. All right, a few things about Utah that you might not know. Utah has been ranked as the #1 place to practice PT by PT in Motion magazine, 6 or maybe even now 7 years in a row. So a great place to practice. We have wonderful patients. We've got good supportive institutions, good financial model, and we have a really still pretty robust workforce demand for PTs. So there are jobs to be had. The University of Utah is a nationally recognized institution. University of Utah Health is the top institution for healthcare in Utah and is in the top 10 in the nation. This is a very highly respected academic medical center, level 1 trauma center. So if you're a hospital-based specialty, you'll benefit from seeing patients from the whole Intermountain West region, and also recognized for excellence in a variety of realms. University of Utah is a Tier 1 research university, and the DPT program here is highly ranked as well. So we've got a really awesome functional institution that values excellence in all areas, and our residents definitely benefit from that. We have a variety of partner institutions as well. Some notable institutions include the Salt Lake City VA Medical Center, which our ortho residents spend time in, and then also Primary Children's Hospital and a variety of other PEDS providers in the Salt Lake area. So if you're interested in the PEDS program, you'll learn more about those partner institutions. Another thing that we can offer to our residents at the University of Utah, because this is a large and kind of broad institution, we can offer to our residents the full spectrum of specialty care. So you can see, all along the whole patient care continuum, and a variety of kind of more niche areas as well. We also offer our residents a full salary and benefits that is prorated to the amount of time that they're spending in clinic. So our residents spend 75% of their time, so about 30 to 32 hours a week in clinical patient care. And so they receive the salary for those hours and the great benefits from University of Utah. We offer on-site mentoring and multiple mentors for each of our programs. And then we also have elements of teaching, research, community engagement, and also offer the certified clinical instructor course for all of our residents. We have a small cohort. We have 10 residents this year, and next year we will have 11 as we're adding a second resident to our sports program. So we're excited about that growth. We also can boast very awesome outcomes. We've had first-time NPTE pass rates have been amazing over the life of all of our programs. So you can see that we're definitely above average for anyone taking specialty exams and even residents taking specialty exams. And I could add the 2022 data in here as well, which was also 100% first-time pass rate. Same if we divide that up by specialty area. We don't yet have data for peds or for our cardiopulm because we're just in our first. We're still waiting for our first NPTE exams for those, and then acute care does not have a specialist certification exam at this time. You may know that Utah has amazing. I can't remember who it was that just said Utah was like the best place to ever live, and I know that's debatable, but it is a pretty special place. We have mountain, alpine, and desert, and 5 national parks and a few others with an easy driving distance. So it's a great place to live and recreate. Salt Lake is a beautiful city, easy to get to the mountains from here, a few hours away from some of the desert. Okay, I'm going to stop here, and then Haley, would you give me back host capacity? And I'm going to have you all choose which breakout room you want to be in. So you can visit with any of our program coordinators or directors, and you should be able to choose your breakout. Is it open already, Haley, or do I need to do that?
Yep, it should be open.
Okay, so go ahead and choose your breakout and have a great session.